Please welcome your host for this evening, Professor Lord Patel of Bradford OBE, President of the Royal Society for Public Health.
Wow, lovely to see you all. Ladies, gentlemen, honoured guests. And when I talk about honoured guests and distinguished guests, we have some distinguished guests today. Some great, famous faces that you'll all recognise as the evening goes along. It's my absolute pleasure to welcome you all to the Royal Society for Public Health's National Health and Wellbeing Awards to celebrate achievement and best practice in improving and protecting the public's health. And I'm sure you'll all agree it's never been more important to celebrate and recognise all the amazing individuals and organisations working in public health. Tonight's also an international event as we're streaming to nearly 200 guests who can probably see me but can't see you all. We've got them from across the world, including Nigeria, the USA, India. So a very special warm welcome to those of you from across the globe, making this truly an international celebration of best practice in public health. And for those of you here in person at this fantastic venue, I hope you'll not only enjoy the food, the drinks and the company of your colleagues, but also you'll make many, many new friends. Of course, this evening wouldn't happen without the important support of our partners who have sponsored these awards this evening. Your support, our partners, is invaluable, making this event a huge success. So on behalf of the Royal Society for Public Health, I'd like to thank each and every one of our sponsors of this year's awards, categories and tables, including Mental Health First Aid, the Philip Family Foundation, I'm supposed to all fly up there, Future Fit, Elsevier, IDEX, MSD and Moderna, and of course, Sage Publishing for the Perspectives in Public Health Journal Award. Thank you very much. This evening we'll recognise some amazing work, and that's really important. But what's also really important is you have a fabulous time. Look, we've got our suits and shirts on and our fancy dresses. Chill out. Seriously, chill out. So every year I've done this, and I must say, this side of the room is always more boisterous than this side of the room. You see already? Yeah, yes, you see? So if I ask this side of the room to say RSPH, they'll do it louder than this side. 1, 2, 3. RSPH. There's always the odd one, but 1, 2, 3, beat them. And those of you a fan of social media, and again it should flash up, but it's not working. There you are, look, hashtag RSPH Awards Fair. Make good use of it. Take pictures, tweet it, get it out there. Look, I've been really proud to have been involved as the President of the Royal Society for Public Health, and especially these awards, for 14 years. And I've enjoyed working with the many dedicated assessors, staff, and these awards are really well recognised, they're really well coveted. If you get shortlisted, you've done really well. These are really, really important. And I've been so supported over the years by Natasha, Vice President. And it's great, I can say I'm the President and Natasha's the Vice President. But next week, and this is a big deal, I'm the Vice President somewhere else, and she's just become the President. And she has got the best job in the world. She's going to be President. So when you go to the cinemas, you'll see her signature on the black card. She's become the President of the British Board of Film Classification. Well done. That's fantastic. We've had interest from hundreds of organisations for this year's awards. So, and I'm really pleased. I mean, look, every organisation that applies goes through a rigorous assessment from our expert panel of award assessors. And I'm really pleased tonight that all 20 finalists are here in person to celebrate their achievements. So thank you for all coming. In my books, you're all winners. So it doesn't matter. You're here and you've done it. I'm going to stop talking and introduce William Roberts. Now, the first time I met William, it was absolutely clear to me how enthusiastic he is about leading this organisation. Because he described it in one sentence. He described being the chief exec of the Royal Society of Public Health as being the best job in the world. And we're pleased to have you as well. Welcome.
Thank you, everybody. Gosh, follow Lord Patel. Okay, so I'm going to say firstly, thank you. Thank you for coming along tonight. It's a real honour to have you here tonight. It's a real honour to see so many people who care deeply about public health. Thank you to our judging panels. I know that you worked really, really hard to bring this to us tonight. And also thank you to my team and the staff who've worked really, really hard. This looks glitzy and exciting, but today some of our team were filling bowls with apples and polishing things. So, you know, there's real people who've done the work tonight. And I just want to say thank you to the team and to others, including Janice, who doesn't want me to mention her. It's also amazing to be here with some of our really long-term partners. We mentioned Mental Health First Aid. We've got some incredibly exciting things happening this year with you, and we look forward to strengthening and deepening our partnership with you this year. Watch this space as we talk about some of the exciting stuff we'll do together to really champion and foreground mental health as being as important as physical health in public health sphere. It's been a really long year, but it's also been an amazing year. Over the last year, we delivered over 40,000 qualifications. 8,000 people came through our organisation to get over 126,000 hours of CPD and development and training. That's quite astounding when you think about that. In this room alone, we have people from as diverse places as, you know, the Isle of Grain, all the way up to, you know, local authorities and corporate entities. And public health really is that broad church, and the RSPH is the home of that broad church of public health. This year alone, we've had over 1.6 million downloads of our journal articles from our 3 journals, which are represented here today in our awards. We have membership in over 60 countries with 5,500 members who tell us about the real things that they're experiencing. And we know that it's a really hard time right now and things are going to get harder. For real people, cost of living crisis actually means you're having to make really tough choices. Tough choices about whether to heat your home, feed yourself and your family, or whether even to have a home and a roof over your head. We also know that inequalities are growing and that we live in a time where fairness really does matter. Because the greater those inequalities, the greater the ill health, the less that you can be able to contribute economically, humanly, and socially to society. And that really matters if we want to safeguard our long-term future. Similarly, that we know that our workforce is overstretched and also exhausted coming out of the pandemic and also from the challenges of the last year. And we want to see a move beyond personal responsibility being the only way in which we talk about public health, thinking about how it can be all of our responsibilities to help people to have good public health. I feel I've rather brought the mood down somewhat from Lord Patel, but actually there's real hope. One of the things that was so exciting about being able to look at tonight's award nominees was to see the breadth and the depth of public health they're delivering. Brilliant work in partnership, really understanding communities, thinking differently about ways to deliver amazing public health interventions. There's something wonderful about the things that we're seeing tonight. They're working together to make sure that public health really is everybody's responsibility. I'm not going to say much more, but I do want to say thank you very much. Thank you very much for coming along tonight. Thank you for letting me have the privilege of leading this amazing organisation, and thank you for letting me do my dream job. Thank you.
I'd now like to welcome to the stage RSPH Vice President, Broadcaster and Journalist, Natasha Kaplinsky.
Well, thank you very much indeed. Hello, everybody. I'm so thrilled to be with you this evening. There was a short moment earlier on today where I thought I actually might not be here this evening because it's nearly my turn to be Prime Minister. But then I realised there are another couple of people on the list before me. What a day it has been, and what a mess. However, it's something like today and the environment in which we're meeting that makes us realise quite why it is so important that we meet to celebrate the vitally important work that all of you do. It's no overstatement to say that this is genuinely one of the highlights, the beacons in my diary throughout the year. I'm frequently asked to host awards ceremonies, and they don't always mean quite as much as this one does. This year I've had the huge joy of celebrating cardboard boxes, bus stops, and handing out all sorts of awards to the world's richest people who own super yachts for having the most amount of marble in a bathroom or something. So you see what I mean when I say that actually genuinely this award really does matter. What you do really does count. So I am thrilled to be back on this stage. Kamlesh, it's such a pleasure to be your Vice President, one of them, and it's a great honour to be part of this very special charity. As one of the organisation's vice presidents, I am immensely proud of the hugely impactful work that the charity does and the work that you all do to ensure that we all live healthier, happier lives for longer. As a broadcaster and a journalist, I'm only too aware of the many pressures which can impact our mental but also our physical health. This year, more than ever, with the cost of living crisis, with the rise of fuel, the shortages we have, the ongoing war in Ukraine, for many, if not all of us, these pressures will be greater than we have ever experienced before, and therefore more support will be needed. It's going to be a hard winter. There's no looking back on that. And we all know that the struggles will be harder, for some more than others. Making the choice for many between, as William said, buying nappies, turning the heating on, putting lights on, or just simply feeding our families. So it's reassuring to know, isn't it, that organisations like RSPH are here not just to shine a spotlight on these issues and how we best deal with them going forward, but why it is vitally important that we have the incredible organisations, many of whom are finalists tonight, who work tirelessly to make a hugely positive impact on the differences that they make on the communities, the length and breadth of the country. Now, these organisations have worked, and they continue to work, under incredibly difficult circumstances with tightening budgets and reduced resources. And I'm continually blown away by the innovative work and the incredibly high standards still achieved by all of the organisations who are shortlisted and we highlight this evening, and of course the wider public health community as a whole. They truly prove that for public health to succeed, we need to look at it from a government, from local authority, business and community level, and of course we all need to work together. I don't know of an awards ceremony quite like this one. Despite the variety, the huge variety of entries, we are all unified, are we not, in one common purpose: to improve the nation's health. And that is truly inspiring. So if I could ask, you're a very generous audience, I know, throughout these ceremonies, but if I could ask for you all to give yourselves a huge round of applause for everything that you do. Thank you so much. So it is a huge honour for me to have this opportunity to thank all of you for the extraordinary work that you do, the incredibly important work that you do, and to wish you continued success as the world circles faster and the challenges are greater with resources that are more scarce. So this evening is a celebration, an enormous celebration. It's where we all have the opportunity to shine a light on exceptional commitment. And while each and every single one of you in this room certainly deserve individual praise, we are now going to move on to highlight the individuals and the organisations in the room that have truly shone. So as Lord Patel said, a huge, huge congratulations to all of you who are finalists already in this room for the RSPH Awards this evening. Well, as you also know, this awards would not be possible without the incredibly hard work of our assessors. So who better to join me up on this stage to co-host this part of the ceremony than Graham Rushbrook, Chair of the Health and Wellbeing Awards Programme. Graham, a pleasure to welcome you up onto the stage. Now, I have had very many presenting partners over the years, but Graham really stands out as being extra special. So it's wonderful to be with you again this evening. So tell us a little bit about the awards.
Thanks, Natasha. I'd be delighted to. It's an honour to be here again and to be co-presenting with Natasha. The Health and Wellbeing Awards are now firmly established as the flagship awards to recognise and celebrate those working in all areas of improving the public's health. And as Natasha's mentioned, these awards are the kite mark of excellence, and winning one really does demonstrate the incredible impact an organisation is making. And it can also be hugely beneficial. Over the years I've been working on the awards, I've had so many finalists and winners tell me that the recognition these awards bring has helped in securing new funding, building new partnerships, and ultimately helping with the long-term sustainability of their projects and programmes that they choose to work on. But one of the very real reasons we all work in public health is to help improve the health and well-being of the public's health. So well done to everybody here today in taking part in the awards. And I'd also just like to add, applying and submitting your applications is not a small effort. We do recognise it takes a long time. Someone has to sit down and trawl through lots and lots and lots and lots of paperwork. So for you to be here as finalists really, really is an important celebration of the work you do and recognition of the organisations that you represent. 2022 has been a great year for categories across all 7 of our award programme, and organisations that work in commercial sector, public and voluntary organisations, as well as the community sector. It really has proved difficult selecting winners for each of these categories. We really have been spoilt for choice. It is an incredible achievement to be shortlisted tonight. And as chair of the awards programme, I do want to pay a special tribute to the hard work of the awards assessors, and I'd like us to pay special thanks to them, many of whom are here tonight. So would you join me in a short round of applause? I hope that was enough, Natasha. That's all I really wanted to say.
Absolutely. Well, we're going to kick off in a moment's time, but just a little bit of housekeeping. For those of you who are lucky enough to win an award this evening, you have a non-speaking part. Okay? Your job is to really bask in the glory, to come onto the stage, collect your award, have a photograph. There's no chance to thank your wife or your lover or your dog or anything. You just literally smile and get off. Are you happy with that? Great. So we are going to crack on with our awards. And the first award of the evening is for Arts and Health. This award has been incredibly kindly supported by the Phillip Family Foundation, and we would like to extend our thanks as we know that the Phillip Family Foundation are joining us online. So thank you very much indeed for sponsoring this award. The nominations are Converge, a partnership between York and St John's University and the NHS Trust. Where's Converge? Come on, set the tone of the evenings. Cheer and clap. Well done. Amazing. Also nominated, Made by Mortals for their programme Hidden. Awesome stuff. The third nominee in this category, St Helens Borough Council and LF Trust for their programme Creative Alternatives. Congratulations to you as well. And the winner is... Lovely stuff. A bit of a drum roll. The winner is Made by Mortals for their programme Hidden. Congratulations. If I could ask a representative from Made by Mortals to come on and collect this award. Thank you.
The assessors said Made by Mortals programme Hidden is a great example of using lived experience to support public services. Using arts as the delivery mechanism for these interventions is particularly effective and showcases an area of the wider workforce who are not traditionally associated with public health.
And our next award is for the Health at Every Age category. And the nominations are Kalisa for their intensive therapeutic programme Face It, Nottingham Trent University's programme Healthy NTU, and the winner is Nottingham Trent University's programme Healthy NTU.
Nottingham Trent University Healthy NTU programme is a great example of a university putting the health and well-being of staff and students front and centre. Assessors told us the collaborative approach to the development and peer support practices embedded within the programme demonstrate a commitment to the Healthy Universities framework and the whole university approach.
Awesome stuff. Our third award tonight in our category next is the Community Health Development Award. And this award is supported by Future Fit. So please can a representative from Future Fit join us onto the stage to help present this award. Where is Future Fit? All about the knees coming onto the stage, isn't it, in high heels? Right, the nominations in this category. Lambeth Early Action Partnership for their postnatal meals service, bridging the gap for families created by the COVID-19 pandemic. Congratulations. Very popular choice there. Second on our nomination list, Cancer Research UK for their Talk Cancer training and interpreted workshops with Bradford District and Craven Clinical Commissioning Group. Well done to you. And our third nomination in this category, Swim England and Good Boost for their Swim England Good Boost partnership. Congratulations as well. And our winner this evening is the Community Health Development Award is Swim England and Good Boost for their Swim England Good Boost Partnership programme. Congratulations.
Assessors were impressed with the Swim England and Good Boost partnership, particularly as it represents an excellent programme incorporating AI and community assets to offer tailored health services in the community. The integration between leisure services and the NHS supports better outcomes for healthy life expectancy.
Our next category is Health and Wellbeing in the Workplace, and this award is supported by Mental Health First Aid England, and I would now like to ask a representative from Mental Health First Aid England to join me on stage to help present this award. And the nominations are Guy's and St Thomas's NHS Foundation Trust, National Grid Grain LNG for their Health and Wellbeing programme, and Unilever for their Healthier You programme. And the winner is National Grid Grain LNG for their programme Health and Wellbeing at Grain LNG.
Assessors describe the National Grid Grain LNG programme Health and Wellbeing at Grain LNG as a particularly impressive application with an innovative and sustainable approach to workplace wellbeing. Built alongside the community, it focuses on passing on knowledge, mentoring to support mental health, and improving the levels of physical activity.
Speeding through the awards this evening, our next category is the Healthier Lives Award. And I'd like to ask Dr. Jenny Harries, Chief Executive of the UK Health Security Agency, to join us onto the stage, pleased to present this award. And you're going to say a few words for us, aren't you? Thank you very much.
Thank you very much, Natasha. When I went into government, I was told I'd moved to the dark side of public health from my Director of Public Health role. And then when I've gone into the Health Security Agency, I think it's got apparently even darker. But I think what I want to say is we are out as an organisation to help protect every individual in every community. And once you are a public health professional, you can never forget the wider public health issues. So as we've seen through the pandemic, managing things like underlying health conditions, chronic disease, obesity, encouraging people to be physically active, these are critical factors in how we support our communities to be more resilient. But even more important than that is the work that I know many people in this room do in helping us reach out to those communities with some of the health protection interventions that we need to support them with. So a huge thank you to all of you who are doing that, and I know there's some exciting people about to be announced.
Thank you very much indeed, Dr. Jenny. The nominations in this category are Greenwich Leisure Limited for their Healthier Together Hackney programme. Congratulations to you and your team. Second on the list, Helam for their U and Type 2 programme. Congratulations for your nomination. And third on our list this evening, Veg Power CIC's Eat Them to Defeat Them programme. That sounds like fun. Congratulations. And the winner of the Healthier Lives category is Greenwich Leisure Limited for their Healthier Together Hackney programme.
Greenwich Leisure Limited Healthier Together Hackney is an excellent programme with population health at its core. Assessors told us that this project is a great example of using community assets to serve the needs of the local population.
Our next category is the Health Equity Award, and I would like to ask Dr. Bola Owolabi, Director of Health Inequalities, NHS England and NHS Improvement, to join us on stage to help present this award. Did you want to say a few words about health equity, Caroline?
Thank you so much for the invitation to be here this evening. And a huge thank you for all the extraordinary work that you're all doing in your various spheres of influence. I think reflecting on the last 2.5 years that we've all been living through, it put paid to the assumption that the pandemic was a leveler. It was anything but. We weathered the same storm, but some people had no boats, some had leaky boats, and some basically sank. But we learned through that process 3 things work. The data is powerful when we use it to drive improvement. Our communities matter. They know the most creative answers to our challenges if we ask them. And we can take a strength-based approach that doesn't see people and communities as bags of needs, but as people with agency and a lot to add. And for all of you who have taken the trouble to look through those 3 lenses, thank you as we push forward and narrow the health inequalities gap together.
Well done.
Thank you, Dr. Owolabi. And the nominations are Brighton and Hove LGBTQ Switchboard and their Dementia Support Project, Somerset County Homeless Health and Wellbeing in Somerset, including the Homeless Reduction Board, and the Food Foundation End Child Food Poverty Campaign.
And the winner is Brighton and Hove LGBT Switchboard, the Dementia Project.
Brighton and Hove LGBTQ Switchboard Dementia Support Project is an excellent example of a programme targeted at a marginalised and disenfranchised group. With an impressive approach to service delivery, assessors said that this programme demonstrates a clear understanding of the community and a strong evidence base to maximise value and impact.
Real gasps of happiness there. That really is very, very special. Well, the final award in this section is the Public Mental Health and Wellbeing Award. The nominations in this category: Haringey Council for Haringey's Great Mental Health Programme. Where are you? Well done. Second on the list, Movember for their programme Ahead of the Game. In the room. And finally, our last nomination in this category, Ripple, for their programme Ripple Suicide Prevention. It must have been very, very difficult to choose between all of these amazing projects. The Public Mental Health and Wellbeing Award winner of 2022, however, is Ripple Suicide Prevention.
Assessors said Ripple Suicide Prevention is a brilliant programme demonstrating the power of lived experience to address a new risk area, social media. The "you are not alone" concept is a real strength, destigmatising the loneliness of mental health to ensure people have access to a network of support.
So many amazing stories behind each and every person highlighted here. A team of really hard-working people supporting all the winners. So congratulations once again to everybody who's been nominated. And as we said right from the beginning, all of you are so special just by virtue of what you have chosen to do with your lives. And I respect you all enormously. So thank you very much.
So thank you, Natasha, and I'd just like to reiterate, it really is an evening of celebration for public health. It's been amazing the last few years how many people have been able to use those words and have some understanding of what they mean, and it's lovely to see it reflected in this room tonight. So thank you once again for all your energy and all your efforts. It's incredible. Thank you.
Ladies and gentlemen, please welcome to the stage Jonathan Pearson-Stuttard, Chair of RSPH.
Thank you very much, and it's a pleasure to be with you all this evening. It's a real honour to become the Chair of the Royal Society for Public Health, particularly at what is such an important time for public health. For all of the wrong reasons, perhaps, everyone's work in this room will be all the more impactful, all the more meaningful, and all the more vital over the months and years to come. At RSPH, we're launching a new strategy, with William joining a few months ago and launching the strategy as our new Chief Executive. And it's an exciting, forward-looking, solution-focused and coalition-building strategy. At its heart, there are three key voices: that public health is everyone's business, that inequalities matter, and that we must empower a public health workforce to drive prosperity. If we unpick each of those three, what do we mean by each of them? Public health is everyone's responsibility. Now, looking around this room and reading all of the nominations for the awards, we could rephrase that as perhaps more accurately saying everyone can improve the public's health. And I think particularly over the last 2.5 years, that's never been more striking. Irrespective of what you do in your day job, irrespective of where you live or what your background is, each of us can improve the public's health. The second is that inequalities matter. Not only do they matter, and it's the right thing to do, but we know that health is our most untapped opportunity for prosperity, for happiness, and for social mobility. If we could narrow that 27-year gap of a man living in Blackpool versus a man living in Richmond in London in terms of life expectancy, narrowing that a little bit would drive huge economic growth and reduce inequalities more broadly. And finally, the public health workforce. Empowering the public health workforce with skills and training to make that change and drive that health and drive that prosperity in all of our communities, in all of our lives on a day-to-day basis. Now, in public health and in my public health training, we're taught all about the social determinants of health. Now, it's absolutely right. These social determinants, as we've been told, are some of the biggest drivers of inequalities, that some of the biggest drivers of ill health. But what I don't like about that is it sounds very defeatist to me. And if you read all of those nominations and all of the winners tonight, all of those things that sound like determinants, they've driven, they've improved it. And these are drivers of public health that with all of our collective action, they can be changed, we can foster health, we can foster prosperity, and we can reduce those inequalities. And we look forward to working with all of you in this room and our stakeholders more widely in driving this strategy across the public health sphere over coming years. So it's my great pleasure to present the next award for the evening, which is the journal Perspectives in Public Health, published by Sage. Before we present the award, I'd like to thank a special thank to all of the very hard-working and terrific editors who contribute their time to making the journal such an impactful and important read as it is. The journal covers topics from obesity to climate change, from the arts to health, and it has insights on every page and thought-provoking in equal measure. For the award this year, we have joint winners for the most highly cited articles in the journal Perspectives in Public Health. The winners are Dr. Karen Mack and Dr. Feifu Bu for their paper, The Predictors of Engaging in Voluntary Work During the COVID-19 Pandemic, which was analysis of data from 31,890 adults in the UK. And secondly, Gina Reinhardt and Dragana Vidovic for the paper, Understanding Loneliness, a systematic review of the impact of social prescribing initiatives on loneliness. Unfortunately, Gina Reinhardt and Dragana Vidovic can't be with us tonight, but I'd like to welcome Dr. Mack and Dr. Bu, please, to the stage to receive their award. now like to welcome Lord Patel back to the stage for the next part of the ceremony.
Yes, me again, sorry. Look, it's absolute pleasure, an honour for me to be presenting the RSPH Honorary Fellowships this evening. The awarding of RSPH Honorary Fellowships recognise those individuals doing an amazing job in public health. And tonight we're honouring 4 special individuals nominated by Royal Society for Public Health members and trustees. Our first honorary fellowship goes to Professor Sally Bloomfield, Chair of the International Scientific Forum on Home Hygiene and Honorary Professor at the London School of Hygiene and Tropical Medicine, in recognition of her tireless work on hygiene in the home and everyday life. Sally, please could you join us on the stage? Well done, Sally. Our next honorary fellowship goes to Dr. Andrew Fraser, OBE. Andrew's had a long, distinguished career in Scotland, most recently as Director of Public Health Science with NHS Health Scotland. He also served as Deputy Chief Medical Officer for Scotland, held many senior positions in public health, working in such important areas such as obesity and health inequalities. I'm delighted to award this fellowship in recognition of his dedication to improving the public's health and services to healthcare, especially within Scotland. Andrew, welcome to the stage. Our next honorary fellowship is for Dr. Suzanne Lee in recognition of her dedication and support of the RSPH, especially in the important area of water safety and infection control. Dr. Lee is a state-registered clinical scientist and a renowned expert in the field of water safety in buildings, particularly Legionnaire's disease. Dr. Lee has provided the scientific expertise and lead for RSPH International Water Webinar series, and this is how many she's done. It was mind-boggling. She's done nearly 60 water webinars to over 17,000 registered delegates. Unfortunately, Dr. Lee can't be with us tonight, but she sent us a short message.
I'd just like to say a very big thank you. I'm really honoured and excited to receive this honorary fellowship. I love working with the Royal Society of Public Health. They do some amazing work and there is a wonderful team to work with. So a big thank you. It really is appreciated. Thank you very much.
This next person, wow. During the pandemic, one of the constants we have all had is the voice of medical advisors. They've summarised the evidence, developed the safety protocols, and worked tirelessly to keep us all as safe as they can. We want to recognise the tremendous service that they've provided throughout this period. Therefore, our 4th honorary fellowship tonight goes to Sir Patrick Vallance in recognition of his work as Government Chief Scientific Advisor and Chair of the Scientific Advisory Group for Emergencies during the COVID-19 pandemic. Sir Patrick, it's our honour to have you here.
much. It's a great pleasure to be here at the end of another quiet day in Whitehall and to get a bit more excited. It's a real honour to receive this from this society, which can trace its origins back to nearly 160 years, 2 years after John Snow's extraordinary demonstration of the importance of water in spreading cholera. And I wanted to make 2 comments about public health. The first is that public health is a discipline, so there are, of course, specialists in public health. But it's also an integration of lots of other specialities, and it's bringing together those different expertise to try to make public health better. And that integrative role ranges from social science, anthropology, through to physical science, chemistry, biology. And that ability to bring things together, I think, is critical and actually is demonstrated by what we've seen tonight with the awards, which have covered such an extraordinary range of backgrounds, expertise, and input. And it was that ability to bring together people from different disciplines, different expertise, different backgrounds, different organizations that was so critical during the pandemic. And we could do that because of the strong science base in the UK. So my second point about public health is that if you look, and I'm sorry to put a complete downer on this, but if you look at what's going to happen, it is absolutely inevitable there will be another pandemic at some point. It's not whether there's going to be one, it's when there's going to be one. And we know, of course, that that's not the only sort of public health threat that all nations face, from non-infectious to infectious diseases and many others, and as we've already heard, the cost of living crisis. But there's one thing that's absolutely clear already from before the inquiry on COVID, which is the most important thing that we can do to make sure that we're in a good position to tackle whenever another pandemic comes, is to have a well-funded, well-supported, high-quality public health system. And so I'd like to really congratulate the Society for what it does to ensure that that is the case, and say, for goodness sake, carry on, because we're going to need it. Thanks very much.
I'm definitely building that office at home now. Thank you. Right, this brings us to the part of the evening we've all been waiting for, the Public Health Ministers Award. And to join us to present this award, I'd like to welcome Dr. Caroline Johnson, Minister for Vaccines and Public Health and also Parliamentary Under Secretary of State for the Department of Health and Social Care. I know how difficult it is for a minister to manage their diary with the commitments you must have at the moment. So it really does mean a lot to everybody at the Royal Society for Public Health and everybody in this room that you are here today and you've been with us all the way through. Welcome to the stage.
Thank you for inviting me. As a consultant paediatrician myself, health and wellbeing is a really important topic. I'd like to thank the Royal Society of Public Health for doing such great work in organising these awards tonight. The awards celebrate the very best partnership and creativity between all strands of public health colleagues. I'm really grateful to have the opportunity to attend this award ceremony and to be able to share this evening with all of you. I first want to congratulate every one of the shortlisted entries. They should all be proud of their achievements. There were 76 applications this year across the 7 categories, and the variety and the originality of the projects shown in all the applications is really very remarkable. Being able to tackle public health challenges is an essential element of the government's commitment to invest in preventing ill health, promoting healthier lives, and addressing health disparities. It's also an important complement to our plans to continue to invest strongly in the National Health Service and in social care. We all know that tackling public health challenges requires action from all of us: national and local government, the NHS, the third sector, statutory agencies, employees, individuals, and more. In national government, we won't avoid our responsibilities, and working together, there is so much we can all do to help make the nation healthier. It has this year been an incredibly difficult job to decide the winner of this year's Public Health Minister Award. This is our drum roll.
This is a drum roll.
But after careful deliberation, I'm delighted to say that the winners are Swim England and Good Boost for their Swim England Good Boost partnership.
The Swim England Good Boost Partnership is a standout initiative that is highly innovative, evidence-based and replicable. The panel said that this is a fantastic programme incorporating AI and community assets to offer tailored health services in the community. This model should be highlighted as an example of best practice for joined-up working for the benefit of service users.
Again, right. Final award of the evening, and it's going to be worth it. The 2021 RSPH Outstanding Contribution to Public Health Award. I thought we couldn't get better than Sir Patrick Vallance, but this is a good one. For the first time this year, our members had the opportunity to nominate a public health professional who's gone above and beyond and made a real contribution to improve the public's health. This year's RSPH Members Special Award goes to an individual who has really gone above and beyond and shone a light on the role that public health plays in such a crisis as the COVID-19 pandemic. Using analogies that resonated with all of us, he provided clarity at a time when there was so much information coming to all of us. His ability to provide the information and field the questions at regular briefings had us in awe. I'm going to ask Natasha to join me to give this award out because I think it deserves both of us doing it. Right. This award goes to Professor John Van Tam in recognition of his role as the
I have to look over my glasses at you, as is customary. It's quite daunting standing at a podium without a little black box to on. Minister, President, Chair, distinguished guests, ladies and gentlemen, I'm really very bowled over about this and a little bit emotional. So thank you all so much. It really is an amazing honour. So thank you. Public health has already spent a lifetime doing amazing things. You only have to look at the miracle of clean water, the miracle of vaccines, and the miracle of smoke-free legislation to understand just what has already been achieved. But now everyone knows, because it frankly punched above its weight during the pandemic at national, regional and local levels. Everyone knows what public health does, and it's really very much on the map right across the public awareness. But the pandemic leaves in its wake some still big unsolved public health problems: deprivation, inequalities, diet, exercise, weight, antimicrobial resistance. These have all been brought into much sharper focus by what has happened in the last 2.5 years. And as you all know, we live in a time of turmoil and uncertainty in terms of government and what happens next. But it also remains to be seen what the government, or a future government, what their response to public health investment will be in the longer term. And that is something we should press for, but look at with very close interest. And finally, I just want to say, really, themes that many of you from the podium have already said this evening. Public health should be everyone's business. It already involves many more people than those who are formally involved in public health professions. And the wider community of public health practitioners is really important for the future, and very definitely embodied in the membership of the Royal Society of Public Health. And so I predict that, same as Sir Patrick, I predict that public health will be even more important to this nation in the future as it has been in the recent past. Thank you all so much again.
Well, I'm sure you'll all agree that this has been a magnificent event. Great evening. We're going to say good night to all those watching on live stream from around the world. Hope you have a pleasant morning, evening, or night, wherever you are. Thank you for all your support, for the amazing finalists, and for all of you making this a very special evening. Long way to go. Have fun. Good night.